I'm Dr. Rajani Patil. I'm a spine and sports physio. So today's session, we are talking about sports injuries in children. Okay, this is kids from the age of 8 onwards up to puberty. So say 17, 18. So now you should have a reason why you are here, right? So your reason can be that you are a child who plays sports and you want to know some do's and don'ts. You could be a parent whose child is doing a sport and you want to know if you're doing things right, when injuries happen, what to do at home, when to consult a doctor, things like that, correct? So these are the two major reasons why you're here today. If there's a third reason, please let me know. Okay. So we are talking about sports in kids. Now, there are a few things that you do need to keep in mind if your child is in sports. You want to make sure, of course, we'll go through some of the injury patterns that we see, and there are different types you need to be aware of which one it is, because the treatment and management varies greatly. Okay, so the sooner that you understand whether this injury is serious enough to do something about it, or if it is something that is a growth issue and it can is okay to continue, that's important. But the infrastructure for a child in sports is critical. Okay, so if you are a parent and your child is in sports, you want to make sure that the infrastructure around the child is great, which means what? So I'm talking about child who is playing sports. I'm not talking about only kids who are on a professional track. Okay, so we do get in the clinic, we have children who come in for state and for national games. Okay, but even amateur kids who are just playing for the sake of it, you still need to make sure that the infrastructure is good, which means what? That your coach, you need to be regularly talking to your coach about what is happening with your child, which means that sometimes kids don't come home and tell you about anything. They may or may not. Okay, they only when you see your child limping, you say, "Arey, kya hua? Kya problem hai?" Only then the child will tell you. So the coach is the first person who's watching the kid play. That's one. Secondly, you want to make sure that the warm-up, cool-down things are happening properly during the sports. So if that's a missing element, then you as a parent should know to preempt that. Either get it done at home, or you make sure you talk to the coach. Ki, what are you doing? Just be a little bit more educated from that front. The third thing is the nutrition and hydration. Kids may it is taken very, very lightly. When I see athletes, adults, they are a little bit more conscious about their nutrition and their hydration, but children, not so much. Okay, and that has to come from parents, it has to come from the coaches. So if your kid is in any kind of professional track, then you must enlist help from a nutritionist, a sports nutritionist. But if not, then you at least need to make sure that certain do's and don'ts are there as far as nutrition and hydration is concerned. And we will talk about that a little bit later. Uh, the the other infrastructure that you need is you need to have one go-to sports doctor. So it can be a sports physio, like how I am and my team is, or it can be a physician who understands sports very well, a pediatrician who understands sports very well. Okay, so you need to have one medical physio, GP, pediatrician, somebody who is always there, so you can at least get your concerns answered. The sooner the better. Okay, so this is the infrastructure that you need. There is one more thing that you should be doing. If your kid is playing sports, they are playing one kind of sport, right? So if they're playing basketball, for example, or they are doing gymnastics, for example, you are doing sports specific coaching. Coaching ja rahe hain, class ja rahe hain, sab ho raha hai. But what about the fitness level that needs to be there for that specific sport? Okay, so think about that also. That's not absolutely mandatory, but it's a great thing to do so that your child does well in that sport, and plus they don't get injured frequently. Okay, so having said that, let's go a little bit more deeper. Why do we want our children to do sports? I feel sports helps not just the personality, it helps the growth as well. So when our children are anyway from 8 to 9 years old, this is when the growth is really happening, just before puberty, right? Once they hit puberty, the growth is going to start to stunt. So you want to make sure that the potential for growth is taken care of. Okay. But it's not just that. Kids who play sports, even as individuals, adult individuals, they tend to have a strong sense of discipline. They have a strong sense of responsibility. Okay, this is just across the board. They have seen it. Self-esteem is great because they play with friends, so their social awareness, their gross and fine motor, everything improves. So there's no doubt that sports is something that children should do. However, there are certain things that you should be looking at. So these are the sports that your child or you might be playing. Okay, if there's anything other than that, let me know. Now, do we see injuries in all of these? Yes. In all of these, we see some form of injuries, and I'll take you through some of these, but mostly we see that under the age of 10, so 8 to 10 ke beech mein, we see recreational. Uske baad, kids start to get a little bit more serious in sports. By the time, if they've gotten used to 8 to 10 mein, they've gotten used to playing, then the injury rate is lower. But before that, if they are doing recreational sports, then the chances of injuries are higher. Let's look at the injuries that commonly we see. If you look at the picture, these are some of the ones that we see quite a bit. Okay, and I'll break this down for you. And there are sports injuries. Think about sports injuries as it's one of the things that is going to happen. It's a done deal. Okay, kuch na kuch hone hi wala hai. There are very few adults who are in sports or very few kids who are in sports. Sometimes here or there pain happens. Your job is to understand the difference between pain and soreness and what kind of injury it is. Okay, you understand the difference between soreness and pain. Now, if a kid has played sports back to back, or say if they have just gone into playing sports again, say this happened COVID ke baad, when all the kids started going back to sports, so many pain issues came up. A lot of them was soreness. That was just conditioning type of pain that was happening. So that is normal. Soreness is normal. How to distinguish? Soreness is basically when it's usually in a muscle. It can't be in a joint. So it can't be the elbow. It can't be the knee, ankle. Yahan agar hai, foot mein hai. So this is generally pain, injury pain. Lekin if it is in the calf muscle, it's in, bicep, tricep, it's in the back of the shoulder blade, back of the shoulder, things like that. So this is soreness type of injury. Not injury, it is basically soreness. And soreness generally, it will be, so if their calf is sore, for example, then anytime that they start walking, the pain, the soreness, they will feel the discomfort. That is soreness. But if it is pain, then it can be continuous. So whether they move it or not, pain hai hi. So that can be a distinguishing factor for you. But you must know the difference between soreness and pain. So say your child has soreness, what do you do for it? If your child is getting sore after every game or frequently har bar calf muscle mein aa raha hai, har bar shoulder dukh raha hai, then it means that somewhere the recovery is less. What does recovery mean? Generally, what is soreness? It's basically lactic acid building up after any kind of muscle activity. So now what needs to happen to that lactic acid? It needs to get absorbed in the system and get flushed out. If that doesn't happen, then soreness comes. And soreness is usually 24 to 48 hours. And what we think कि चलो rest कर लेंगे तो निकल जाएगा, but that's actually counterproductive. Okay, if you rest it out, then actually the soreness can get delayed more. We do, for runners, we do something called recovery run. So what is that? So if you get soreness, if you do a short game or don't do like an intense, you just go for a short run, you do stretching, you do icing, then the soreness goes away faster. Foam rolling, you've heard of? Foam rolling, definitely children should be doing. All the kids that come to me, first thing I have them do is buy a foam roller. Because if they are in any kind of sports, then they need to be doing foam rolling post the sessions. Or at least Sunday to Sunday, they should be doing that. That's going to help with their muscle recovery fast. Whether or not there is soreness, you need to be doing this. So So look at their protein intake. Agar protein intake kam hai, if their hydration or the electrolytes are less in the body, this is also going to cause soreness. Okay, so we've covered soreness. Clear? How to manage soreness? Okay, do not need to go to a doctor for soreness. You can manage it on your own, but you have to distinguish soreness hai ki pain hai. Now let's talk about pain. Let's talk about injury. Injury mein there are three types. Okay, very important to understand these three types. Management is completely different. One is where there is trauma. Trauma matlab kya? Acute injury. Acute injury. Second is overuse injury, and third is growth related injuries. So acute injury is abhi kuch hua hai and there is pain. Overuse is continuously when they play the same game, not in the second, third session, they will get it later. Okay, that's an overuse injury, same muscles working again and again. Growth related injuries are because of because they are in pre-puberty time. I will explain that to you. That is a growth related injury that needs to be dealt with very differently from overuse or acute injury. So let's talk about acute injuries first. This is the shortest one. This is where there is trauma. Kuch lag gaya hai, gir gaye hai, moch aa gayi hai, things like that. Okay, this is very clear cut how to treat it. You rest it, ice it, do price, okay, and you take care of that. Here you may or may not need to go to a doctor. That depends on how severe it is. Obviously, concussions, bad falls, ACL tear, all this kind of things you need to immediately go to a doctor. Depends on if there is swelling, along with redness, along with pain. That's a sign that if there is swelling anytime, please take your child. First start icing it, first 24 hours. And then if you feel that it's not going away, then you need to take them to your pediatrician or to your physio. Okay. Let's look at now overuse injuries. Overuse injuries are generally those that come usually in the knee or in the shin. Shin matlab kya? Knee ke niche jo bone hota hai, that part. Okay, this usually happens in impact related sports like tennis. It can happen in cricket, not so much. We see it more in basketball, those kind of impact sports, running, those kind. So overuse injury, basically, agar if there is pain and continuous pain. So every time the child goes in, okay, when I played today, there was pain. Every single game, they will complain of pain. They will complain of pain afterwards, and then it could even limit function. Limping ho sakta hai. So if there is pain, say here, this shin wala photo you're looking at. Okay, agar yahan shin mein pain hai, those two pictures that you can see, or yahan foot mein. Okay, foot mein here in the long bones of the foot. If there is pain there, guys, it could be a stress fracture. Kids mein bhi hota hai stress fracture. It could be that. So definitely make sure that you address it. Depends again if there is swelling or if there is continuous pain. So the rule of pain is this. Pain is a sign that something is wrong in the body, not soreness. Soreness is a normal physiological response of the body. But if there is pain, this is your body telling you something is wrong. Do something about it, abhi. Okay. The longer you wait and you ignore the pain, the more serious it's going to become. And then at some point, it's going to become a major injury where it can be irreversible. So I know kids who will keep saying that, okay, knee dukh raha tha, knee dukh raha tha, knee dukh raha tha. The knee was lax. Maybe they were flat-footed. It was never addressed. And then one fine day, the ACL is torn. So then future, the kid can't play quickly, right? There's a complete stop to playing. So don't let that happen to your child. It can be shoulder, right on top of the shoulder here. It can be shin. It can be foot. Any of these. Sometimes kids also get neck, calf, lower back. All these also we see. This is all overuse injuries. It can be absolutely treated. For this, you need to see a physio. Overuse injury category is for a physio. This can be treated and your child can continue to play the sport that needs to be played. It needs to be evaluated by a sports physio, please remember. Somebody who understands sports. Okay, so this is, remember swimming also. Swimming may we see little less injuries, but we do see some injuries. Primarily we see shoulder. Yeah, racquetball. Tennis may we see, tennis and badminton, we see a lot of shoulder repetitive because you're doing the same thing. Recently, I had a shooter, so he's going into nationals and he has pain in his lower back because of the rotation movement and because he was flat-footed, which nobody knew, right? The child did not realize. Of course, he's not a child. He's now, I think he's 16, 17 years old. But he didn't realize, the parents didn't realize, but we caught it, we corrected it, and then the pain, of course, we treated it, but the pain also went away. So sometimes it's understanding the cause and treating that. So that's why you need somebody who understands the sport rather than just treating it by yourself. Okay, so that's an overuse injury. Causes of overuse injuries can be several. Okay, you could have children, we have children who play year round, we have children who play only the 3 months. Okay, so it could be either one of these children can end up with injuries, overuse injuries. So if you are doing, or the reason could be not enough warm up or cool down, not enough recovery, not enough hydration, unsuitable equipment. We will talk about that. Technique, say coaching ठीक से नहीं हो रहा है, that could be one reason. If the coach is not catching it at the right time, it could be excessive. What is excessive? I remember the time when my son started sports and he wanted to do everything under the sun. So what he did, he loves any of these ball games. So he took up basketball, football, both of those he was playing 3 times a week. So every single day he was playing, he ended up with heel pain. I took him off. It turned out to be early severs. Took him off, and then he was able to play. But he was doing, he was doing the same type of activity on all days of the week, right? So that's why I needed to flip it. So then we said, okay, we get rid of one. So you pick between basketball and football, क्या तुमको करना है? उसके साथ तुमको योगा करना पड़ेगा. He hates stretching. This is my child, very stiff. But it's about thinking about what else. So then he ended up swimming instead of he will not do yoga. So think about cross train. So what can you do which is not exactly the same type of sport? What can you do that is different? You will use the different muscles so that overuse injuries don't happen. But remember, cross training also helps greatly in sports performance. So whatever sports you're doing, figure out from your coach or your physio, agar usme you want your child to do better, what is the cross training that we can do with this to help this child further? Okay, and you will get some guidelines on that. So look at this list and see if your child has overuse injuries, or if you are a coach, then think about what could be one of the factor here, and it could be just one. इसमें से कोई एक होगा तो भी it can be happening. Acha, I did not talk about flat foot and incorrect shoes. That's a big one. In fact, recently we did an assignment with Don Bosco International School where we were looking at all the children playing sports, and we were also, and this was a fabulous program that Don Bosco did, the coach rather did, head coach. So basically they brought in all the infrastructure. So the physio, the nutritionist, the strength training coach, everybody came in and looked at these children, and it was fabulous because the kids were able to get 360-degree care. Now let me take you what my take from that was. Hi Glenn. My take from that was that there was so many children at any age bracket playing all kinds of sports, and so many were completely overpronated or flat-footed and nobody knew about it, and because of that they were getting repeated injuries. Okay, so please look at your child and see if there is overpronation. If you're not sure, please connect with me, and it's a quick diagnosis, and the treatment is also simple. Okay, it's not anything major, but if your child is playing sports, you need to make sure that the shoes are correct. Okay, if it is a high arch child or if it's a low arch or flat footed, then we can correct it. The earlier the better. We only do corrections after the age of 8, by the way. We do not touch flat foot before the age of 8, sometimes 7, but not before that, because the child is still growing. Okay, now let's look at growth plate related injuries. Now, what is a growth plate? As adults, our bones are all grown out, right? Why? Because our height, abhi jitni height ho gayi hai, ho gayi hai. Abhi hum aur grow nahi hone wale hain height mein. Abhi we are getting, like I tell my children, they will ask why you make us eat more and we eat less. It's because adults, we don't grow this way. You have scope to grow this way. We only have scope to grow this way. So we have to control what we eat. So the point of saying is that children, before puberty starts, they have something called a growth plate here. So this is bone hai, bone ke do attachments mein there is epiphyseal growth plate. Now what is that? It's a cartilage. It's soft, like the tip of the nose. How that's cartilage, soft bone, like that it is, right? So this allows the child to grow. And when they play sports or when they cycle, they do all kinds of activity, this is helping the bones to grow longer, and hence bacche ka height बढ़ता है. Okay, so that's why the sports is important, because the bone will only grow when there is some kind of impact. However, if the impact is excessive, or if you have not taken care of some of the things that we discussed in the previous slide, which was all of this, then you could have a growth plate related injury. Okay, what is that? There are three phases in this. Stress reaction, which is the first stage, कि there is pain right at the epiphyseal area. So maybe heel is one area, knee pe aata hai, elbow, okay. These are areas that kids will generally say. So these are all joints. See, when it's joint, then you have to know that this is something a little bit serious. If it is muscle, then it's probably something that you can manage, self-manage. Stress reaction is step number 1. It means what? Ki stress hone ke wajah se wahan pain hai. Now the second part is inflammation. The stage 2, if you've not treated it or taken care when it is stress reaction, it's going to go to inflammation. Inflammation matlab wahan bhi swelling aa jayegi. Ye bone area mein swelling aa gayi hai. And because of that there is pain. This is step number 2. Yahan pe, if you are not careful and you continue to let the child grow, play, तो यहाँ पे fracture हो सकता है. Okay, the epiphyseal growth plate पे there can be a fracture. Now this obviously you don't want, na? And this is where then the kid has to be totally taken away from sports. So you want to diagnose it when it is at stress reaction, stage number 1. And generally pain response is what? How will you diagnose? Pain, swelling, redness, and tenderness to palpate. So around the joint, if touching mein pain hai, generally you can say that that's that. Okay, these are the 2 common growth related ones we see, and these are easy to diagnose. Dekho, aur agar hai pain wahan to take care immediately. Some of these things do not show up on an X-ray, by the way. So this is all clinically diagnosed. Orthosports disease. This pain kahan aata hai pata hai? Knee ke just niche. Wait, I'll show you. So on the knee, so if this is your patella, kneecap, uske niche yahan pe ek haddi hoti hai. So this particular bone, what you'll see in your child, you'll see little swelling here, and ye bump bada hota jayega. Okay, so if you have not treated it, that this particular bone is going to keep growing and there'll be swelling there. That's a clear indication that this is a growth related injury. You need to take the kid off the sports at this point, give them rest here, and then maybe even consult a doctor. Sever's disease is heel pain. This is very different from typical heel pain. Yahan agar piche agar pain aata hai calf ke yahan, that is different. This is right on the heel. Heel ka jo bone hota hai na, apna calcaneum. You see the picture? This. There's a growth plate there. You could have injury there. So this again, we've taken X-rays, but sometimes it shows up, sometimes it doesn't. Even a fracture doesn't. So if there is pain here, definitely it's overuse. Could be overuse, or it could be growth related. Okay, so Sever's disease, it means that there is excessive activity happening and not enough recovery happening. So again, you need to take the child off the sports. These are 2 main ones that you need to be watchful for, because this then to treat becomes very difficult. Okay, so now how can you prevent injuries from happening in your child? Proper equipment and safety gear. Kids ke saath tum bhej to doge sab equipment, but whether The coach is taking care, whether your child is responsible enough to put it all, make sure all the gear is proper in good condition and the child is using it. Okay, so based on whatever your sport is, you have to make sure that it's there. The next one is the playing field where they are playing. Artificial turfs, they have shown from research that generally higher rate of injuries hota hai. But sometimes we in Mumbai, I don't know if everybody is in Mumbai, but if you are from out of Mumbai and you have a lot of open playing spaces, then that's wonderful. But in Mumbai, sometimes you don't have a choice. Artificial turf hi karna padta hai, but there you have to make sure that they are maintained well. But then you have to make sure that um, whoever the coach or whoever it is very conscientious of making sure that it is well maintained. Adult supervision, obviously. Now, what a lot of sports does is they will have a team physio along with the coach. And this can be a physio who is watching them play, and if there are small injuries, can take care of them. Or a physio who is just watching and seeing if there is technique mein gadbad hai, ya, if there is movement dysfunctions that are happening while the child is playing, which the coach may or may not be able to catch, but a physio will be able to catch if there are muscular imbalances happening right versus left. So they can just pick out the child and say, okay, let's make sure why this is happening and correct that. And then obviously the game improves. So see if some of that is possible for you. But first and foremost, the parents need to be on board with the coach. They need to be speaking to the coach. Massages need to be done. Nutritionist needs to be enlisted, right? So the parents खाली class भेज दिया ऐसा नहीं होता है. So you have to speak to the coach regularly. Proper preparation and recovery. We already spoke about this. This is an important part. You need to make sure that if the coaches, if the recovery and the proper preparation is happening. So we spoke about warm up and cool down, if it's happening or not, plenty of fluids. So rest breaks are allowed or not, whether the kids are made to drink water, and is water enough? Okay, think about this. Sirf pani se kaam chal jayega, because in Mumbai we sweat so much, and sometimes you're directly in front of the full sun and you're playing, you're losing a lot more than water. You are losing your sodium and your potassium. So you need to make sure you put it back in. So you can do electrol, or there are a lot of other supplements available, electrolytes available, but ORS works. You can just do that. And you can, so what I would do, I would send like one water bottle and one electrol. So I would say, okay, यहाँ से एक sip लिया तो next ये bottle में से sip लेने का, right? So it's balanced a little bit. You don't want to do excessive as well. And protein intake, very important. So when do you want to do the protein intake? In general, obviously, if you're playing, your child is playing, then you need to make sure there is enough protein, because we see that the children, their bones are growing, but muscle tone aisa hi hai, patla patla muscle hai. Okay, the muscle is not building only. Why? Because protein is not enough in the body, and that's going to cause issues. So you make sure that in general diet mein there is enough protein. Vegetarian protein, egg is a complete protein. So either that or after every single game when they come back home, they have to have some kind of a protein meal. Okay, you can do a milkshake, you can do eggs, you can do, I mean, I'm not a nutritionist, but you can, if you want ideas, obviously you can speak to a nutritionist, but some basic protein needs to be done after every single game. And before the game, you give them something carb so that they have energy to play. Okay, so if you are having to send dabbas before and after, you do that. And make sure you give little carbs before and protein definitely after, so that the recovery happens, muscles are recovered, soreness nahi hoga, and their muscles are growing well. Okay, we spoke about this when understanding if there is soreness, pain, growth pain, bone pain, muscular pain, what is it? Okay, some of these things. So whatever I told you till now will help you self-diagnose to some extent. Of course, if you are confused, you can reach out. But these are the red flags that you want to look out for. if your child has swelling, okay, anywhere, if there is stiffness first thing in the morning, getting up, chalne mein limping ho raha hai, stiffness ho raha hai, redness hai joint mein, muscle mein, walking with a limp, persistent pain in the same area, matlab every single time, are aaj bhi ye dukh raha hai, aaj bhi ye dukh raha hai, okay, this is a sign. These are red flags. If you see any of this happening persistently, then you need to make sure that this is addressed by a medical professional, a sports physio, a pediatrician who understands sports. Okay, clear? Now, taking action fast. Agar pain hai, the sooner that you do something about it, the better. If you wait, then you miss out on the window of recovery and the injury gets prolonged. So RICE is what you want to go with. You want to first rest it, not complete bed rest. Children never will agree to bed rest. But I'm talking about rest from sports for a short period of time. We do not recommend long periods of rest. Short durations of rest along with ice compression and elevation. Okay, so again, people will tell me, nahi, hum to ice karte hain, but you may have heard me say this before. You are not doing enough. Okay, agar din mein ek baar kiya chhod diya, not enough. 5 minute kiya sporadically every other day, not enough. 3 times a day, 10 minutes. If you have iced it, then you tell me that you have taken care of icing. Before that, I will not even treat the child. Some of my kids and parents know this. Ki first ice karke aao, uske baad dekhenge. If it's still not going away, that means it is something that we need to look at. Okay. And so, last slide, cardinal rules, cross train, very, very important. Okay, make sure your child is not doing the same kind of sport again and again. Make sure they are doing 2 different things. Sirf ek sport mein mat dalo, 2 mein dalo, 3 mein dalo, but alag alag cheez karo. Do not play through pain. Pain hai, haan, theek hai, ho jayega. Khelte raho, khelte raho, khelte raho till it becomes a full blown injury. Don't do that. Taking the time to heal fully. So this also is a critical point. We don't like to stop our athletes from playing. We like to have them continue to play, provided it is safe to do so. Like if it is a growth plate injury, obviously we have to take them off the sport and we have to tell them, okay, now it is enough recovered, abhi thoda khelo and gradually go into it. Immediately full blown jaldi, if you start playing again, you will be back to square one. So make sure that the injury has healed fully. Okay, paying attention to gear often. Why? Because it also spoils. Na? Everything has wear and tear. So you have to make sure that you're taking care to see कि वो सब बराबर है कि नहीं. Year-round sports, if your child is playing, you need to give your child 3 months off. Okay, this is a guideline that has come and not many people, kids follow it. So if you are, a lot of sports has seasons, which is great, right? So you play in your season and then your off season, you're not playing, you're doing fitness for that sport. That is excellent. That's how you should be. But from that particular sport, you need to take 3 months off. Evaluate for malalignment and footwear periodically. Why? Because you might have a child who is not born with flat-footedness, but over time, wo arch has been dropping and then you've not realized. Or footwear has now become tight, you've not realized. Remember, that also can cause issues. So guidelines for changing shoes also you should know. How frequently you want to do it. Every year, if your child is growing faster, like in the pre-puberty, then you will need to do sooner than that. So you will have to be on top of the game for that. Keep checking for those kind of things. Flat foot hai ki nahi definitely needs to be checked for all the children who are playing sports. Okay. So that's it for today sharing. Okay, so now let me tell you what we do for sports. My clinic is in Shivaji Park. By the name of Orthosports Physiotherapy. That's my company. We're a team of physios, and what we do for children, other than what I told you for Don Bosco, how we do assignments where we do in schools and in tournaments and things like that, we watch for performance improvement, but we also look for injury prevention. So we can catch injuries before they actually happen, so we can prevent it. So those kind of things we do. Of course, injuries we treat in the clinic. Kids who come in, they could be just playing for recreation, for fun, or they could be on some kind of a track for state or national. So those kinds of things we take care of. We also now recommend our kids who are seriously playing sports, we recommend that they do fitness for that particular sport, because please remember, every sport has a different muscle group that needs to be trained. Okay, जो cricket coaching अलग है, cricket का prehab अलग है. The same thing tennis के लिए is different. Okay, so what exercises we have for tennis is very different from cricket. The muscle groups are only different, what we need to train with. Okay, so that we do, but we keep these kids in between tournaments. We'll see them, and then we'll do every 15 days. Some of our children come to us twice a week, and they do prehab with us on a continuous basis till they have to go for tournaments. Okay, so this is some of the things that we do in the clinic. Flat foot and alignment issues, we obviously check every now and then. I'm huge on prevention. I think we need to prevent as much as possible, not only in adults, but in children as well. Whatever we can prevent, let's prevent. The first thing comes with alignment. Knock knees starts to happen, flat foot starts to happen. All that can be corrected, and sometimes it's just one session of correction. So this is what we do. So if you need help with any of this, please feel free to reach out and take an appointment online as well as in the clinic. I'm in Shivaji Park, Dadar.